So next up, we have Jeff Margolis, who is the chairman and CEO of Welltok. He's also author of the book, The HealthCare Cure, which some of you may have read, all of you should. So most of you know Jeff because he had tremendous success building TriZetto, which he started from scratch, then took public, then took private again in a $1.4 billion private equity buyout, and then sold again for $2.7 billion. What this means for all of us is that we should ask Jeff to take us out to dinner. And we should do this not just because he is a brilliant conversationalist, he is, not just because he can afford it, because clearly he can, but because having had a number of dinners with Jeff, what I can tell you is watching him work over a wine list is like something between like a finely tuned athlete and, you know, a shark devouring a seal. It's terrifying to watch, but then you reap the benefits of it afterwards. So his current great adventure is as chairman and CEO of Welltok. And hopefully he'll tell us a little bit about that today. They are experiencing growth. They have raised a good amount of cash, most recently from folks like Bessemer, Emergence, Interwest, and I guess they just scored the first investment coming out of IBM's Watson Fund. What you might not know is that Jeff has been a patient of this system that he has dedicated his career to transforming. So when he was just 19 years old, he was diagnosed with Crohn's, and he spent 100 days in the hospital, had over 7 surgeries. And I think this might be the reason that despite his enormous success, he remains really humble. He has a killer sense of humor. And I had one night a discussion with him about his experience with the healthcare space that was easily one of the most human and hysterical discussions I have ever had in my life. So ladies and gentlemen, Jeff Margolis, an incredible entrepreneur and a really good soul. Jeff.
Thank you. All right. Afternoon, everybody. How are you? Good? Nice weather you had. I wasn't sure I was going to get here, but whenever I come into Boston, I guess it reflects my general sense of value. So this great world of academics, probably everybody in this room is more educated than I am. Based on my basic cultural upbringing, I'm not a physician, which in my particular cultural upbringing means I'm not a fully formed fetus. But I keep hanging around doctors and academicians trying to learn and trying to grow. And this whole thing about my background of my illness, it is true, I have Crohn's disease. I sit on the National Crohn's and Colitis Foundation board. I have spent 100 days as an inpatient. I think the thing I would tell you with some level of sensitivity, right, but the joke in the industry is that 30 years in healthcare and healthcare IT, I know the industry inside and out, but the industry knows me inside and out as well after those surgeries. So it's good to be with you. What I wanted to talk to you about this afternoon is perhaps a little different than some of the things you've heard. Perhaps it will tie together some of the things that you've heard. By training, I am a systems scientist, but I also have a CPA, which was as close as I could come. At least I could belly up to the bar with the doctors. So that makes me both a geek and a nerd, and perhaps then an entrepreneur, and having been a Wall Street public CEO for the better part of a decade or so, I'm going to try to bring you some different perspectives. We hear about how we have to change this industry, and the concept that seems to be out there today that drives everyone is this concept of disruption, right? We have to do something to this industry, and I have to tell you, I've read the books. I don't disagree with some of the principles, but I think that, as in most things, we should try not to find silver bullets or oversimplify. And I want to talk to you a little bit about what I think is necessary to create success in a digital health company or a connected health company. And that's what Dr. Kavader asked me to talk to you about this afternoon. Let's start with this is always how you get introduced, because we live in a land of capitalism, and we tend to measure things with the sort of banal statistics that you see up here. And it's not that I'm not proud, but I'm a lot more proud about what's not on this chart. I'm a lot more proud about the fact that when we created TriZetto, which is the company that takes the benefit dollar and distributes it through the sick care system in the United States, how the dollar gets sent to physicians, hospitals, pharma, and medical supplies, that we knocked about 5 to 7% of the cost of healthcare out of the country through administrative efficiency. That makes me proud, not the size of the company so much. I'm proud that we broke open a space, which everyone talks about now, software as a service, so that we could learn or experiment and frankly skin our knees trying new things in terms of how we get technology into the hands first of workers and then ultimately consumers. Today at Welltok, what we're trying to do, and I'm not really going to talk about the company today, happy to talk to some of you afterwards, but let's just say that if we have enough things going on in the industry for the sick care system, what about the rest of the system? What's the platform that's going to take all the innovation like you see out in the hall there, the innovation that you see being capitalized on both coasts and a little bit in the middle, and how are we going to draw that together? It's a big challenge. It's a really huge challenge. So I'm going to just talk through, I think, 6 principles with you today, and hopefully they'll be useful to you as you think either about investing or about your research, applying to business, or how to grow a business if you're developing one. So the first place I go is a lesson that I learned when I was a young person. I was a guitarist. I was actually supposed to go to a fairly famous music school that I got admitted to, which I did not. But I did play in the jazz band at the University of Illinois, where I did go to school. And on the jazz band wall was a sign that said, "To be truly innovative, you must first be steeped in tradition." And I think that what happens in business today is that people confuse intelligence with innovation. If you don't know what's going on in the industry you're trying to serve, it's very difficult to develop a breakout idea that's an idea of any size, right? And so most people know the parable of the blind men and the elephant, although I find actually in the millennial generation, they don't know the story so much, right? But the quick version of the story, right, is a neighboring tribe came up to the edge of a village, and they had an elephant. And there was a lot of fear about what this beast might be. And the village that they came upon had only blind people in it. And the blind people went out, and one touched the ear of the elephant and said, "It's dainty and soft. Why are people afraid?" Someone else touched the tusk and said, "Oh, it's a weapon of great force." Someone else touched the leg. And of course, the parable is there was only one, the truly wise man of the wise men, that walked around and touched every part of the elephant and understood what the organism in total really was. And he is the one that was able to go back into the village and lead and discuss how to work with and talk with this other tribe. So the thing about healthcare is it's vast, right? It's enormous. So if you look at how this elephant is carved up, how many of you are physicians in this crowd? Okay, leave your hand up for a sec. How many of you who are physicians have an intimate understanding of how health insurance companies work on the inside? Keep your hand up if you do. Okay, all right, good. How many of you work in health plans? How many of you have an intimate understanding of how retail pharmacy works? Walgreens, Walmart, things like that. Some of you, right? Now think about how much knowledge and cross-pollination it takes to understand all of those things. So here's what I think about a lot is if so many smart people, which you are, and who have also come before you in the industry, spend so much time trying to solve a problem, it usually means from a systems science point of view that something is missing in the equation that they're trying to solve, or else they just keep hitting their head against the wall. So to build a big company in the digital health space, even if you're going after a targeted niche, I would say to you, you need to understand the different aspects of the industry. The second is to understand the hassle maps of the different constituents in the industry and to architect through their lens. Okay, so you just heard Kyra, I think very, very eloquently, talk a little bit about behavior. And, you know, I remember in the 80s and 90s when we talked about re-engineering, and we came up with this construct of when did you intersect with the consumer and what were called moments of truth. I don't know if some of you remember that, right? And we somehow delude ourselves in the healthcare industry into believing that the intersection of our business model with the patient or consumer represents the lens of that consumer. So in other words, if I'm a health plan, those touch points I have with the consumer, that's how I think about the consumer. If I'm a physician, those times I have touch points with the patients or follow-ups. But that's not the year in the life of a person, of a consumer, right? The consumer life, even someone like me who has a chronic illness of some severity, you know, you can't even measure in 0.1% the percentage of time that I spend in a clinical setting. So what's going on with me the rest of the time? How do I think about understanding my health risks and needs? How do I understand my health benefits and maximize those benefits? How do I manage and take care of the things that I can manage for myself? So far I haven't said anything about doctors or hospitals or anything, right? Then how do I seek services and how do I seek goods in healthcare? And then how do I receive support across the spectrum doing that? So it's important when if you're trying to build a company in the health space, a technology company of significant scale, that you step back and think about the flow of the constituent you're trying to help, whether it's a physician, whether it's hospital administration, but you got to think about their lens on the world and the lenses that they come into contact with. Principle number 3 today. You know, over the past few years, we've all learned a lot about workforce diversity. We've learned a lot about multicultural things, and I think most organizations, you know, understand this in a certain context. But what I want to tell you is the context of creating workforce diversity and building a digital health company is different. And in fact, what you really need to think about is how do you put the right amount of focus on clinical versus administrative versus consumer versus technology, so on and so forth. My favorite business book is actually a book called Execution. And what Execution holds out is that there's really only 3 processes in a business. There's the strategy process, there's the people process, and there's the operations process. And I guess what I've come to learn in 30 years of experience is that the strategy process, usually there's some vision or some sort of construct the company's trying to get at in the first place. So strategy is not easy, but usually there's somebody in the organization that's got reasonable control of the strategy of the organization. And when it comes to operations processes, there's plenty of people in the world that can execute on projects and timelines and building technology and so on and so forth, so long as they know what to build. But getting the right people mix is extremely difficult, right? How do you put in the right influence in any company today of clinicians, of millennials who have a different learning style than perhaps some of us who are a generation past them, versus finance people that understand how you're trying to generate returns in the investment community. Okay, and I'm not going to go through all the different types of people, but I can tell you that if you really think about it, it almost seems like in any startup or even early stage company in healthcare, you might need to have almost 100 people in your company to cover all the bases of all the perspectives that can influence. Very few companies have that kind of capitalization to fund 100 people. So think carefully about your people mix, and think carefully about how that mix reflects the customer or consumer that you're trying to serve in the to-be world that you're trying to get people to. I will throw in one humorous anecdote. The business we're running right now at Welltok is a business that does provide a platform to get consumers engaged in those things that they can control in a personalized way throughout the year. And I put forth a design principle to my team where I remind them that when it comes to consumer engagement in healthcare, men are stupid. And so if you design with the principle in mind of understanding, it's kind of funny and it's kind of true, right, guys? That if you design with the principle that you're trying to serve a particular audience, if we all know that in most households who makes most of the decisions, then you should have a mix in your team that reflects the thinking of that target audience. This is probably my favorite one. This is the one I probably get the most trouble in for being quoted in magazines and so on and so forth, which is we somehow in healthcare technology have this fascination with gadgets, right? There was the Apple announcement, right? Everybody has a Fitbit or a Jawbone or someone. You know, how many of you have had a wearable fitness device sometime in your life? How many of you have one on right now? Okay. And so what happens is gadgets are things that you can, they're applied information technology. There's a lot of technology in gadgets, but they're essentially based on things like style, retailability, so on and so forth. And it's not that they're not valuable, but contrast that to the power of information technology. Google search, that's a technology, right? That's a technology that you can build a very, very big business with. We happen to work with IBM Watson, which is cognitive computing technology. Why? Well, for a very simple reason. The whole healthcare industry so far, and almost all the systems that we have in information technology and healthcare are based off of codes, and those codes are designed to do what? Reimburse physicians or in hospitals and so on and so forth, right? But do consumers think in codes? Consumers don't think in ICD codes and CPT codes. They don't give a rat's rip about those things, right? Consumers think in the context of how they understand information, how they learn information, and so on and so forth. So you need to have a technology that can learn and grow and change with the consumer. Call it big data if you want. Everyone's running around talking about big data. That makes me sick too. But it is big data if you want to look at it that way. But what I like is lots of data that's very focused on solving a specific problem. So I like making big data small on behalf of the consumer. But don't get too captivated by gadgets and point solutions if you're trying to build a big company, because I guarantee you that a better gadget will come along later. So how are you going to swap? How is your gadget going to get swapped out if you're building one? Or how are you going to accommodate the next gadget if you're trying to fit it into your structure? All right, don't confuse revenue growth with cash. I won't spend too much time on this slide, although I know a lot of people in here aren't necessarily business people, right? But you know, you talk to a company and you say, you know, how are you doing? And they say, well, we're not at revenue stage yet. And then you talk to them a little later and go, how you doing? Gosh, we got a couple $1 million of revenue. And then you talk to them again and they go, yeah, we've got like $8 million of potential bookings backlog that we can sell to people. And then you talk to them next time and they're out of business. Why are they out of business? They're out of business because they didn't stay ahead of the curve that they needed. The bigger and more expansive the idea you have, the more capitalization it's likely to require. It's very difficult to bootstrap companies in healthcare IT and digital healthcare. And sort of back to the you have to know the industry, there's never been a garage band that produced a hit in healthcare of any size. And we've had a few pretenders out there that are privileged children of wealthy people who have started and sold companies in our business, but don't confuse those with the kind of discipline that you got to put in place. Never raise cash when you need it. Always raise the cash, if you can, before. That'll free up your mind to make the best decisions. And just because you have cash, don't necessarily spend it, right? and that's what companies did in 2000 and blew up the dot-com thing. And we are dangerously on the brink in healthcare IT right now of having over-investment in companies that think they need to spend it. Avoid headline distractions. I love coming to Boston. I taught in the Harvard Forces of Change program for a number of years, and I used to love coming here because so much went on around here. But I would encourage you in building up a business to avoid headline distractions. Stay focused, because what's being said in the papers is usually being dumbed down to some least common denominator. It sounds really important, but if the principles of what you're building in your company are important enough, they transcend politics. They transcend the latest announcement from Apple. They transcend the latest announcement from Google. Not that those things aren't important, and that going back to the respect issue, we should respect all of those things, okay? But you shouldn't turn the boat too quickly to follow these things around, or else you may find that, you burn a lot of fuel going like this instead of getting to the line of where you're trying to get in your business. And finally, what I would say is if you're going to be an entrepreneur and you're going to get on the road, you really need to know what you're in for, okay? When you come up with an idea, so let's say you followed the first principle and your idea is at least based on a good knowledge of the industry as opposed to just your intelligence, because everything seems like a good idea when you're smart. But the road looks really clear. The road looks really clear. And you start driving on it and you start building your idea. And if it's really a good idea, you know what happens? More cars come on the road with you because they're watching you and they're listening to you. And you know what? Some of them are run by some pretty good people. And some of them even pass you on the road. And what you got to think about as an entrepreneur trying to build up a business is, what is your level of stick-to-itiveness? Your investors who are in the business with you, do they want to get to that next hill and that next hill? Or is their interest in getting off at an exit so they can pull the handle on a certain level of return at a certain amount of time? Or frankly, possibly even say, we've done enough, we're done for now, it's time to stop. And having the courage to stop sometimes is as important as having the courage to know how to go forward. And frankly, some of the best CEOs I know are CEOs that know when to call failure on an idea, and then learn from that and move on to the next idea, right? But it is like a commute. It's always longer than you think. It's always more painful than you think. And I guess in closing, what I would just say to you, if you kind of look through these tips that I'm giving you, I don't know if there's huge wisdom in here for you, but what my hope is in addressing this audience today and being invited to come here is that if you sort of focus on kind of two of the points I made, one is the people part of how you put people and teams around you, right? And then if you really focus in terms of respect for the industry as it exists, then your ability to move this world from the as-is state that we all needs to be better to the transformative to-be state that we know that we can have, we're going to have a smoother road, and you guys are going to have a lot of success getting there. Thank you very much for your time this afternoon.